Phillies.
No.
Simmer down. Simmer down.
It's only a couple slides. And then Monday we'll have a little movie day, Halloween party, or whatever.
Oh, we gotta ask Miss
Should I
Clifford.
bring popcorn or do you guys have enough snacks?
We'll bring some stuff.
We all love popcorn.
I'll bring some popcorn. Yes.
Is it possible to take the final early and not come in during the final for patient care?
No, they're gonna say no.
Oh, did he get approved for us to wear a costume?
Oh yeah.
No, he said
I think Halloween is canceled.
Oh, yeah, we can't. I think we can wear. I'm
I'll
gonna
ask
try.
them again.
I'm gonna try mine.
Hey, just bring something just in case. You know, you can change.
I'll ask them again.
Just a headband.
That man said he's sick and tired of telling us.
But we did want to let you guys wear like wigs and makeup and stuff, but then the seniors were acting up, so then.
Oh, yeah. It's like everything on it.
They've been doing too much recently.
They ruined everything.
That's why they were at the zoo.
Keep throwing these zoo shots at.
We
You
had.
call it Zoom, but you scared me with the black stone one.
So, class time.
Oh yeah, no, they hate
We can
us.
discuss everything else later. So last week, yes.
This is about class. You haven't sent those out, right?
No, not yet. I will today. So, oh no, Miss today. Sorry.
But why weren't the ones acting up? Yeah.
You want to know a joke?
Just the ones left.
No, you're fine.
Yeah, it says the one for 2023, right?
All right, focus, guys. So last week we had, or Tuesday we had a question. I forgot what day, but the difference between solution and suspension. So suspensions, they usually have more particles in them. They're not like all dissolved, so it's probably going to look cloudy and not transparent. A solution is kind of like a saline solution, where it's clear, you can see through it. It's like salt completely dissolves in water, so that's a solution. Suspension, the particles don't completely dissolve in it, so it looks like thick and cloudy and not transparent. So that's the easiest way to explain the difference. Barium is a suspension, not a solution.
Is that why you don't do you don't put it in the body? Like,
Yeah,
because it doesn't absorb, right?
correct. We stopped here, I think.
Yeah.
Thank you. So we talked about drugs, and do you guys remember which organ excretes?
Liver. The liver.
Kidneys excrete. What does the liver do?
It's the main.
Metabolize.
Oh, yeah.
I don't know, I just know that that one made me a drink.
So drugs, we know that they have a variety of side effects, correct? For example, what's the, I guess, brand name for diphenhydramine? Benadryl. What's a side effect of Benadryl?
Sleeping.
Drowsiness, yes. So that's a side effect. But if someone were to take Benadryl and they ended up throwing up, that would be an idiosyncratic reaction. So that's basically a reaction that does not occur in most patients. So whatever side effects they have is not as common. So with the idiosyncratic reaction, the side effect resulting from that drug causes a unintended response.
Specific to that patient.
Correct. For contrast injections, we know that a common side effect would be feeling that hot flash or feeling like they wet themselves. But if, let's say, they started saying like, oh, I can't see, or something's going on with my eyes, that's an idiosyncratic reaction. Because that's not common. Right? Can I move on?
Mm-hmm. I don't know. Change it?
sorry, ma'am.
Okay, here we go.
Ms. Spania, please can you go to the last statement of the last slide? Medication is commonly used for allergic reactions. So that's what you use it for the allergy, right?
Yes.
The side effect is drowsiness. So,
So,
what are you trying to?
drowsiness is a common side effect to Benadryl, right? If a patient has any other side effects that are not drowsiness, that would be idiosyncratic, yeah.
Right.
That was the end of chapter 21.
What?
Short chapter?
Very short. Moving on to 22. So, 5 rights of drug administration. Don't do drugs. Remember these for your test. You have to know the 5 rights. Right drug, right amount, right patient, right time, and right route. What do you think these 5 rights mean?
Give the right.
Using the right patient.
The right
Using the right
patient, the right patient, patients that are at the right time, and
Yes.
make sure these are information.
What do you mean, right?
Right
Make sure
route.
that's
Like slaves.
Intravenous or through time.
Oh.
Yeah, so the purpose of these 5 rights of drug administration is to prevent medication errors and to prevent harm to the patient. So for us as technologists, we would use these 5 rights in CT, MRI, etc., where we inject medication. So you always have to make sure, first of all, is it the right patient? Okay? Is it the right drug that I'm giving the patient? If it's an allergy patient, I know that it's going to be Visipake, not Omnipake. And then certain scans, you have to know that you give 100 cc's or 150 cc's. You have to make sure you're using the correct IV. Inpatients come down, they may have multiple IVs going on. The nurse is supposed to tell you which one you can use, so make sure you use that IV. And then of course, the right time. When we inject contrast, do we inject it while the patient's waiting in the waiting area?
No.
No, you have to, they have to be on the table, correct? And if they're getting an abdomen scan, sometimes they have to get oral contrast, so that is usually given 2 hours before the scan. So we have to make sure we're giving the contrast at the right time.
A quick question.
Yes.
So, like, let's say, for some reason you're in CT, right? And you're doing your 5 rights, but one of them you made a mistake. You can lose your license, but you just lose your certification for CT, but you still keep the radiology?
I think you lose both.
Even though it happened like in CT.
Yes, because even though you're a CT tech, you're still a radiographer too. You're still taking x-rays. So, right patient, how do we verify that it's the right patient at Harris Health?
First you ask them and then you see the check it with the.
Check 2 before you do.
Check 2 before you do, right?
Say it again?
What's the policy at Harris Health? Check 2
Before
you do. So you ask them their name, date of birth, medical record number, make sure it matches on their armband. So what would you do if you're a tech and you go upstairs to do a portable and you see that the MRN on the patient's wristband does not match the one that you have on your paper?
Don't do it.
Don't do it, stop the line. So you have to let the patient's nurse know, and they have to get that corrected through the, I think, registration. And until they have that correct armband, you are not to do that x-ray. Okay.
My question to you.
Yes.
If the patient is not responsive, then checking the band is enough, or you have to do something else?
Yes, checking the band is enough. Because if the patient has an incorrect band and it matches the one that we have on the paper, that's not our fault, because it matches, right? That would be a nursing fault. But if you see that it doesn't match and you do go ahead and do the x-ray, then it's on you. Right time, we already went over this. Always make sure that the drug that you're administering, you're giving at the right time, because it may have reactions to, different medications that the patient has in their system. So always take a look at the timing. Right route, always make sure you're using the correct IV, or as especially for nurses, they have to verify if it's through the IV or if it's through the PIC line or which route they have to use. And then, of course, you always have to verify the correct dosage and the correct medication. So usually in CT or MRI, as soon as you are doing the procedure, Epic already has a system built into it that lets you put in what drug you gave the patient, which IV you used, what the time was, what the dosage was. Everything is already recorded in the patient's chart. You just have to go in and select the correct amount. And also, if for some reason the patient refuses getting any medication or what have you, you have to record that in the system as well. So make a note of anything you think will be important for other healthcare personnel to know. Don't make unnecessary notes. For example, we had a tech at Bentop, his name was George. He would literally put in anything and everything. He would put quotes. I went up to the patient's room. Patient was in an irritated mood. He said, "Do not put that hard ass plate under my ass." End quote. So don't put stuff like that. Be professional, you know. Use your common sense.
No,
He's like, well, I would rather
So, drug errors. In medical imaging, the most common legal problem is errors with drug administration. So anything that goes
Contrast.
wrong while we inject the contrast, that's the most common legal problem that we face. If you make a mistake, what do? Do you just hide? And no, you have to report it to your supervisor and you have to report it to the radiologist so they know the correct steps to take in order to prevent any more harm from happening. And also, if you ever make a mistake involving contrast injections or doing the wrong exam or doing the wrong patient, you always have to report it. It's called an SI report or incident report, and you have to go in and explain everything that happened so the correct people can investigate and then prevent that from happening in the future. So hospitals like Carousel or MD Anderson, they usually have certain like awards that they get, like Magnet or #1 Research Center. All of that happens because they are always improving ways to prevent patient harm. Okay, and if you are honest and report what happened, you usually won't get fired. They will, you know, kind of counsel you and maybe make you take prevention or safety classes in order to prevent that from happening. But I think at MD Anderson, if you do the wrong patient once, you're immediately let go. I think.
Is that
Yes.
because of the type I'm sorry. Is that because of the type of patients that they see? Like cancer patients or those who are immunocompromised
Mhm.
and extra radiation or extra stuff might just interfere with everything that they've been doing?
Yes, at MD Anderson, they're constantly getting CT scans and all kinds of radiation, so they're really, really strict about over radiation to the patient.
Okay.
I have a question. Is the
Yes.
magnet program only part of like the nursing thing?
Yes, because they're always trying to prevent like harm medication or fall to the patient, and I think they may look at CT and MRI too, if I'm not mistaken, because nursing is also part of that.
Is any of the Harris Health Hospital part of
Magnet?
Bentop is.
I think Bentop and LBJR.
Oh,
Medical abbreviations. So, we have several that we use specifically in X-ray or nursing. PO stands for per os, meaning per mouth. So if a nurse calls you and says the patient is NPO, that means nothing by mouth. They're not to eat or get anything by mouth. PRN is per needed. Stat, we should all know what stat means. Statum, meaning immediately. And the Joint Commission and Institute for Safe Medication Practices are the ones that deal with a list of unacceptable abbreviations. For example, if you like write IU, it may be confused for IV. So they are the ones that deal with unacceptable abbreviations. You don't need to know what those abbreviations are, just know that it's the Joint Commission and Institute for Safe Medication Practices.
So, a physician writing IV, like in place of ibuprofen or whatever, that would be incorrect.
Yes. So it's always best to write out the word that you're trying to say than making abbreviations.
Unless it's a standard abbreviation.
Yeah, if you ever make notes with your pen or pencil, make sure you write legibly. You don't want other people to interpret it in a different way. And if you are confused about what it means, you can always double check.
So those three were the specific ones that you want us to know.
Yeah, PO, NPO, PRN, STAT.
Or four, I apologize.
So in medicine, we have certain units of measurement that we use. It's, metric system is universally used for drug administration specifically. Meter, liter, and gram are the units of measurement used. And then we also use milliliters for medication, for liquid medications. You may hear people refer to it as cc's. That's just the same thing as milliliters. cc's are not a metric measurement. Only these four.
CCs are not what now?
They're not a metric measurement. So meter, liter, gram, milliliter, those are all metric. Routes of drug administration. What does enteral mean again?
Enter?
It
Enteral.
enters the body.
Through
Could you
the
s-
digestive system.
Enteral? How do you
Enteral.
spell that?
Mhm.
Oh, I'm sorry.
And then what about parenteral?
It does not.
It does not deal with the digestive system. So we have oral, sublingual, buccal, and rectal. They all deal with the digestive system, correct? Oral is the most common way to administer drugs. Sublingual means what?
Under the
Under your tongue. Buccal is against the cheek. It could be either up here or down here. And then rectal, we all know what that is.
That last was for you, John.
Way down.
If you don't know, now you know.
So why go for buccal as opposed to sublingual? Is it because of the vessels? Yeah. It's extended release.
I guess it depends on the medication that's given and how they want the body to absorb it.
Would that affect their gum line or their teeth at all?
I don't believe so.
Do they really?
Is that why they do
Put
the?
it like right.
Say
Again,
with your chest.
Oh, so
Say with your chest. What's your question?
Oh, okay.
What's your question?
Oh, I see.
Even if like.
No, it's okay. Nobody's listening.
Is that you know the chew? Like a drug?
Yeah.
So, like, pull it and leave it, like-
Oh, you mean tobacco?
Yeah.
Yeah. Because there's a lot of blood vessels there. So, John, sorry, I don't know why I keep saying that.
Don't have to.
Miss Bonilla,
Yes.
John brings up a good point. The
Keep going.
buccal, would that be like chewing tobacco
You know how people put tobacco like
in their
In
lip?
the dip?
Yeah. Would that be considered? I know it's not a
Wow, I don't know. That's a good question.
because nicotine is considered like a drug. You would get patches and whatnot, but
that might be the most optimal way too.
Maybe.
and it's regulated.
So maybe putting it under the or on the
Some
cheek.
drugs are probably better
So,
absorbed in some.
Possible bonus question: dip is considered a what?
I have no idea. I know it's
No.
something
Bad
to do with
choice.
tobacco.
None of the above.
Do not do stop.
What would be the most optimal way to do it?
So we have some more routes of drug administration. Topical, what does topical mean?
Absorbed by the skin.
Absorbed by the skin, medication that's applied directly onto the skin. The drug diffuses through the skin and then it's absorbed into the bloodstream. And then transdermal, patch. It's a patch placed on the skin, and the precise dose of drug is delivered over a certain period of time through the skin. And we already said what parenteral means.
It's not intramuscular.
Does not deal with the digestive tract. So we have intramuscular, intravenous, and then subcutaneous. Intramuscular means what?
Through the muscle.
Through the muscle, and then intravenous is through the veins, and then subcutaneous is under the skin. So drugs that are injected parenterally, for example IV, have a rapid onset of action because it's directly into the bloodstream, correct? And then for parenteral ways of drug administration, we must use aseptic techniques. You know, before we start IVs, you always wash your hands, make sure you're wearing gloves, don't touch the needle, that's all aseptic techniques. With parenteral routes, infection control is of high importance, okay? And then make sure you know that it's OSHA that issues the standards on bloodborne pathogens, infection control, needle stick safety, etc.
Ma'am, sorry, what did you say parenteral? What was that? Would you write it down?
Not
I'm just
digestive.
reading it.
Not
Or
di-
not through the GI tract.
Yes. So what are some examples of needle stick safety?
Cleaning.
You dispose needles in a sharps container, correct?
Yes.
And then also, if you're ever accidentally pricked by a needle on the job, you have to report it, so then they can test you for any infections that you may have accidentally gotten.
During one of our cases in IR, one of the medical students got splashed in the eye, and the patient did have HIV, so she like freaked out immediately, and it seemed like she was having a panic attack, so they just told her to leave the room. She went to the eye wash station, washed like herself for a good I think 3 minutes, and then opted to not go see the testing thing. I don't know why.
Okay.
So the surgeons and like the doctors kept saying like go get tested, go do that. She said I think I'm fine. I'll wash out for a little bit.
Oh, I would
So-
not take that risk.
Yeah.
No,
So I was like, that's a
no,
pretty
not ever.
pretty lame way to get it. But
Alright, well, when she gets it, she'll
she gonna get it.
And then she's gonna try to sue him.
So, with intravenous, it's an immediate onset of action because the drug is injected directly into the bloodstream. Intramuscular, it's rapid, but not immediate like IVs. And then subcutaneous, it's slow and constant absorption. Okay? All parenteral routes require the use of a needle and syringe. Yes.
So lidocaine would be intramuscular or subcutaneous
I believe intramuscular.
because of the way that they do it.
Yes.
But it is subcutaneous, right? So then when it goes under the skin.
It's just it's immediate though. Like you
Yeah.
can see the cloud appear and then it's gone.
Yeah.
Like on ultrasound.
Really?
So, different ways of injection have different IV angles. For intravenous, we have 25 degrees. Subcutaneous is 45. Intramuscular is 90. That's usually how vaccines are given. And then intradermal is 10 to 15.
You must know this.
Yes. Well, we already know intravenous and intramuscular, right? So then use common sense to remember the other two. So, parenteral administration must use a needle and syringe. In the textbook, it says that an angiocath is a safer device compared to other systems. Angiocath was the needle that we used for IV practice. It's no longer true because there is other safer ways of IVs out there. And the needle diameter is expressed in gauges.
The higher the gauge, the smaller the needle.
Yes.
Or the land, and undercut the sea for the body.
It's the type of
Yes.
needle.
So is the main property that
Yes. And then make sure you know the different parts of a needle. We have the bevel towards the tip, we have the cannula, and then the hub. And that shows you a closer look at the bevel. It's that angle part of the needle.
Is there a term for the inside space of the needle?
Just cannula.
Okay, so cannula can be the inside, but also the like shaft and covering
Yes.
itself. Okay.
So for intramuscular or subcutaneous, the needle would have a long bevel, and then for IVs, it would be shorter.
Is that to distribute more at once?
For intramuscular,
Mm-hmm.
most likely yes.
But you probably get the medication deeper inside.
Yeah. Doing like that. 25.
So if we have an 18 gauge and a 24 gauge, which one is thicker?
18.
18, yes. So the smaller the number, the larger the gauge. Or larger the thickness. IV administration, there's 3 methods. The first one is slow injection rate with single administration route, where the medication would be injected at a slow pace. Then we have what's called a bolus. So that's when the medication is injected very rapidly, and there's a specific amount that's injected very rapidly. That's called a IV push.
Oh, is that when they pump the IV back?
Good time.
You know how they have a little ball thing, you click it and it like compresses it, so it pushes so more IVs.
That's for fast food. That's not for
No,
fast
I don't think so.
There's a valve that they use in IR where they'll have like I think it's called a 3-way, and one line will go in. They have like a syringe on the side. They'll pull from this IV bag after introducing like a medicine and clipping it. They'll do this suction motion, and then it like flushes all the medication with a bunch of saline at once.
Oh,
But the contrast they can like pull out or whatever, and then have it dump into like a gross bag. That's
Maybe
like
that is a way of IV push. Not a nurse, I'm not sure.
Okay.
And the last one would be a drip infusion. That's when you see patients that come down to the department with the IV poles. They're getting that medication at a slow, constant rate, correct?
What? That's it.
Venipuncture.
Where'd you see
So
that?
we went over this a couple of weeks ago. First and foremost, we have to make sure the patient is our correct patient. We have to explain to them what you're about to do, make sure they don't have any allergies, get all of your supplies, make sure you wear your gloves.
And it's done. So,
Do you want me to go through all these steps?
We're good.
Yes, yes.
no,
We did, we learned it.
I was gonna say, bro, that's an error, dog.
No, we
So,
got it.
with intravenous medications, such as contrast, if we inject the medication and extravasation occurs, it's usually going to be in that first 30 seconds. So if you see the patient screaming and calling for help, don't just pretend you don't hear them. Go in there. First thing you would do is to do what?
What's your name?
Remove
What's
the
your date of birth?
needle,
Oh.
right? Remove the needle out of the main, and then you would give them a warm compress to put it on that site, so the swelling will go down. Usually all CT rooms have a little compress in their cabinets already, ready to go. So go in there, run in there, get the IV out, make sure they're not bleeding, give them a warm compress. And then because we did have a incident happen, what would we do?
Report it.
Report it to the supervisor, let a nurse know, and then put the incident report in.
Ma'am, what exactly does extravasation mean and infiltration?
Someone wanna tell her? Yes.
When you miss or if you blow out the vein and then bubbles form when you push something in, or
That's which extravasation.
Yes. So instead of going into the vein, the medication goes into the skin instead. And that's very painful for the patient.
And
And
infiltration.
contrast is very toxic.
And infiltration.
That's the same thing.
it was a different word.
You got to. You got to.
Or you guys are just well, because you have to be,
You have to be aware of things that are happening, right? You don't just want to be like, oh, I'm an X-ray tech. I don't know how to help.
I mean, that's the best thing you can do because you don't want to get like.
Best thing.
I mean, I'm hoping some of y'all will advance after X-ray, not just stay in X-ray.
Like doctor.
After being with Ventyne, X-rays, you think I'm gonna stay?
Yeah.
No.
Yeah, but don't have to do that?
Yeah, yeah, yeah. Cause they do too much.
All right, 2 more slides.
Woohoo!
So, for patients that come with IV infusions, have you noticed that big square pump that's attached to the IV?
Yeah.
So pay attention to the IV pump alarms. We usually don't mess with any of the buttons on the alarms. The only thing that I would mess with is the silent
Yeah.
button, because that thing is annoying as hell.
You gotta ask your nurse first though.
No, you don't.
No, you
You
can
just
put it
put it.
on silent. Just don't do anything else with the numbers or anything.
Oh, that thing beeps really loud too.
Yeah.
Yes, usually it's beeping because it's not plugged in, or if the patient gets up and the IV kind of like twists or something, it'll start beeping, if there's an occlusion.
I was
So
trying to
that's
bring it
important
in
that you
yesterday,
know.
and I was pushing the pull, and it started beeping, and then I looked at the screen and it said air in line. I was like, oh
Yikes.
my god! I was like, I didn't know what to do. I was so scared. I was
You're by
like,
yourself?
no. But T was new too. We were both looking at each other like, I don't know. She was like, I don't know.
Yeah, just let the nurse know, they'll know what to do.
Yeah.
You know, let's hurry up. You can take it.
And then last but not least, always follow the golden rules of drug administration, which is what?
Short-
Five
five rights.
rights, yes.
Right to give it to them, the right now.